Lead, a naturally occurring heavy metal, once widely used in various applications. While its utility seemed promising, we now understand the profound and devastating impact it can have on human health, especially on the most vulnerable among us, our children. This is the story of lead poisoning, a global public health crisis that continues to cast a long shadow. Lead poisoning, or plumism, occurs when lead builds up in the body, often over time. Even low levels of exposure can cause serious and irreversible health problems. The World Health Organization estimates that globally, around 1 in 3 children, up to approximately 800 million children, have blood lead levels at or above 5 micrograms per deciliter, a level at which action is recommended. This is a staggering statistic, highlighting the widespread nature of this environmental hazard. While lead poisoning is a global issue, certain regions are disproportionately affected. Low- and middle-income countries bear the brunt of this crisis. Regions in Africa, Asia, Latin America, and the Eastern Mediterranean often have higher rates of lead poisoning. Several factors contribute to this disparity. My son Mateo was always a bright and energetic child, but lately, he's been having trouble focusing in school. He's also been more irritable and complains of stomach aches. We live in an older building, and I've noticed some chipping paint. Maria, your concerns are valid. Deteriorating lead-based paint, commonly found in older buildings built before lead was banned in many countries, remains a significant source of exposure, especially for children like Mateo. They can ingest paint chips or inhale lead-contaminated dust during normal play. Beyond paint, other sources contribute to lead exposure globally. Contaminated soil from past use of leaded gasoline or industrial activities is another major pathway. Children playing outdoors can ingest this contaminated soil. In some areas, lead in drinking water due to aging lead pipes and plumbing fixtures is a serious concern. Certain industrial processes, such as battery recycling, mining, and smelting, release lead into the environment, affecting both workers and surrounding communities. We also see issues with imported products like some toys, traditional medicines, and cosmetics that may contain lead. Even lead-glazed ceramics and leaded crystal can leach lead into food and drinks. The signs and symptoms of lead poisoning can be subtle, especially at lower levels of exposure, making it difficult to detect. In children, we often see developmental delays, learning difficulties, irritability, loss of appetite, weight loss, fatigue, abdominal pain, vomiting, constipation, and in severe cases, seizures. These effects can have lifelong consequences on a child's cognitive and physical development. Mateo has been having some of these symptoms, the stomach aches and the trouble focusing. In adults, the symptoms can include high blood pressure, joint and muscle pain, headaches, abdominal pain, memory problems, difficulty concentrating, mood disorders, reduced sperm count in men, and complications during pregnancy in women. Sometimes there are also numbness or tingling in the extremities and general fatigue. The impact of lead poisoning is far-reaching, affecting not only individual health but also societal development and economic productivity. Early identification and intervention are crucial. A simple blood test can measure the level of lead in the blood. Treatment primarily involves removing the source of exposure. In cases of high blood lead levels, chelation therapy, where medication is used to help the body remove lead, may be necessary. However, the focus must be on prevention. Prevention strategies include testing for lead-based paint and safe remediation, ensuring access to safe drinking water by replacing lead pipes, implementing and enforcing regulations on industrial emissions, promoting safe recycling practices, monitoring imported products for lead content, public awareness campaigns to educate communities about the risks of lead exposure. Addressing lead poisoning requires a multifaceted approach involving governments, healthcare professionals, industries, and communities working together. We must prioritize the health and well-being of our children and future generations by eliminating lead exposure wherever it exists. I will definitely get Mateo tested and take steps to ensure our home is safe. No child should have to suffer from this preventable condition. Maria's concern is shared by millions worldwide. Lead's shadow looms large, but through awareness, action, and collaboration, we can work towards a future where all children can grow and thrive in environments free from this toxic threat.